ask you about Obamacare and where things stand. It's going to be a big political issue. There are people in polls that say, I don't know if I can take these premiums. They're killing me. Obviously, there's a side that says you've insured more people. But your assessment right now as HHS Secretary of where things stand?
So my assessment about the Affordable Care Act is it was about three things: affordability, access, and quality. And with regard to access, we've made historic reductions. The 20 million people who now have insurance that didn't have it before, the fact that your kids can be covered up to 26, and the fact that we have the lowest uninsured rate that we've had as a nation. So access, good progress there. With regard to the questions of affordability and quality, these are both places where we know we want to do more work, but there have been improvements through the Affordable Care Act. Whenever there's a premium increase, we know people feel that. And so we have to keep working. Progress has been made, but there is more to do.
Right. But isn't there a concern that the costs of this law to taxpayers could be much more than originally projected, and that the subsidies are not going to cover people, and they're going to essentially leave the marketplace?
What we've seen in terms of the Congressional Budget Office estimates, we've come in much lower in terms of the costs, and that's something that we'll see over time. You are correct that when premiums go up, subsidies will, but we are still under those costs, and the premiums themselves in the marketplace are still under those too. But for the vast majority of Americans who are in employer-based coverage, for those folks, the quality of coverage and the things that are very important in terms of pre-existing conditions, and most folks know somebody who's had cancer or something else, and if they ever have to make a switch, they don't have to worry.
We chose a random city on healthcare.gov. A family of four in Lincoln, Nebraska makes $80,000. They can get a silver plan for about $600 a month in premiums after subsidies. Now, it estimates the annual cost to be more than $11,000 a year. That's more than 13% of their income before taxes. So how is that affordable for them?
So what I think is important to remember is for that family before, without the subsidy and without the assistance, they wouldn't have access to it. And if they had a child that had asthma, for instance, they wouldn't have access. And that's what's different now. While improvements have been made, there's more work to do to get to the place where affordability is felt by all.
How many co-ops will remain at the end of the year?
I think at this point we don't know how many there will be. The co-ops were an important part of the competition in the early stages, but one of the things about the co-ops, when you think about it, it's a different business model, and that's something that new companies I think have struggled with. Some have been very successful. But the co-ops had a couple things as they began that were challenging.
A lot of health insurance companies are now joining in this lawsuit against the administration to say that essentially they're not going to get their money out. And Republicans are charging that the administration tried to do something illegal, unconstitutional, by using different money to pay the insurance companies. What is the real result there? I mean, was it an illegal action to kind of shift that money around?
There have been a lot of court challenges that have gone through, and we continue to have those, but as they go through, I think you've seen that those are cases that we win. We believe we have the authorities. One of those suits you mentioned has to do with something about cost sharing, and that's one of the things that creates affordability.
It will be a political issue. I know you're optimistic, but for Republicans who say they want to unwind this thing, how difficult is that? And is it more of a reality they're going to be fixing this structure?
So I think that right now it is about what people feel and believe, and I think most people in the country don't want to go back to a world where pre-existing conditions could prevent you from getting care. And for the 20 million who have insurance, I don't think we want to go back, and I think that's what will be defining.
And even the nation's largest insurer leaving the market, you think this is still sustainable as it is?
So that particular insurer, in terms of their decisions, there are a number of other that represent a much larger portion of the marketplace that have made statements that they're in and they want to work through, and many of them have expressed that they want to grow. And so what I think is most important is we focus on that outcome for the American people, which is people getting quality, affordable coverage.
Secretary Burwell, we really appreciate you coming in.
Thank you so much for having me, Bret.